Public Hospital, Let's Make It. On September 26, 2003, the committee held a public hearing of Seongnam citizens to resolve the medical gap in Jeongwon-gu, Sujeonggu. With more than 500 citizens attending, the committee proposed two measures: opening and operating a local medical center in Seongnam City, or immediately treating the Inha Hospital building to Seongnam City Hospital until Seongnam City attracts a university hospital. Whether it is building a new public hospital or hosting a university hospital in Seongnam City, it takes time to raise the building. Therefore, the existing Inha hospital site should be leased with buildings and medical equipment to resume treatment as soon as possible. Then laid off employees can get back into work. It seemed the most ideal proposition at the time. During the public hearing, a citizen raised his hand and shouted loudly, "Even if 500,000 citizens bet 10,000 won a month, can't you make a hospital? Signature exercises alone are not enough. Now let's raise the fund and push it specifically. Let's do it." All the citizens in attendance applauded loudly. The situation in Seongnam was known throughout the country. An official from the Korean Confederation of Trade Unions Health and Medical Workers Union said that one of the participating government's pledges is to expand public health care by 30%, which requires strengthening medical publicity and expanding health insurance coverage by more than 80%. At that time, Mokpo Catholic Hospital and Jinjabit Psychiatric Hospital were also in the middle of a campaign to switch to public hospitals. Proposals made around September 26 resulted in the establishment of a new public hospital. After a public hearing, the Inha and Seongnam Hospital closing Pan Citizens Countermeasures Committee decided to expand and reorganize into the Seongnam City Hospital Pan Citizens Promotion Committee, and decided to launch a one-man declaration campaign and a civic fundraising campaign. Professor Kim Young-ik of Seoul National University also suggested, in order to expand public hospitals, small private hospitals should be converted into nursing hospitals. The government should provide quality improvement funds to large private hospitals with more than 300 beds, and local clinics should be recognized as observation beds within 48 to 72 hours. Daily Medi 2003, 9.9. The public hearing video at the time can be found on YouTube. https youtube.bha for JCRNOXC. President Roh Moo-hyun said, in a speech to the National Assembly, on the second anniversary of his inauguration, "I will make sure to fulfill the 30% pledge for public health. We will further raise the standard of public health services." Movement for the establishment of public medical institutions. In Korea, one of the participatory government's medical policies was to increase public health care by 30%. It was in line with national policy to expand the area of public health care, which was previously only 10%. In 2003, the movement to establish public medical institutions took place in Jinju, Yeosu, and Gwangjin-gu, Seoul. In Jinju, the Jinju Medical Foundation donated the site of the Nulbat Mental Hospital to Jinju-si in agreement with the Citizens Countermeasures Committee, and promoted the establishment of a public nursing home for the elderly. Yeosu said, the campaign to enact the ordinance on the establishment of Yeosu Medical Center for local corporations was in full swing. In Gwangjin-gu, Seoul, the struggle of local residents to revive the closed hospital as a public hospital due to accumulated deficits continued for a long time. But the transition to a public hospital was unclear when it was auctioned to a construction company. In 2003, Seongnam's campaign to enact ordinances for the establishment of municipal hospitals was the most advanced of all these movements. It was the first time in the country that a campaign to enact an ordinance for the establishment of a municipal hospital took place at the suggestion of residents, after a 6-month struggle by citizens. This incident was recorded as a historical event of the Korean Residents' Ordinance Claiming movement. On this topic, Park Hyun-hee of Seoul National University published a paper titled Political Dynamics and Effects of the Residents' Ordinance Claim Movement, and Park Soon-jin of Jeju University published a paper titled Study on the Success Factors of the Residents' Ordinance claiming system case of Seongnam City Hospital,